wabarakatuh. Good evening, everyone. Good evening, Indonesia, and Om Swastiastu. Welcome to our Institute of Global Professionals free webinar. Thanks for joining with us in this wonderful evening and stay with us till the end. The Honorable Mr. Jonathan F. Daba as the keynote speaker today. The Honorable all of Committees Institute Global Professionals. The Honorable my beloved parents, thanks for watching today and happy Father's Day, especially for my daddy and my mommy. And my beloved ladies and gentlemen. First of all, let us pray and praise to Allah Subhanahu wa Ta'ala. Because of His grace and mercy, we can join together and let us greet and pray to our beloved Prophet Muhammad Sallallahu Alaihi Wasallam, who had brought us to the path of light. I am Windy Puspitasari Suparto from Makassar, South Sulawesi, Indonesia, as the host webinar today and a member of Institute Global Professionals. Ladies and gentlemen, as we know that Institute Global Professional is an educational institutions programmed to social work. We provide effective training and educations and consultations to generate professions. So we expect that you are getting a little bit benefit in a personal and a professional life. Ladies and gentlemen, please like, share, and comment this page. And please like, share, and subscribe YouTube channel Institute Global Professionals because your attachment encourage us to do better and best service to our lovely audience. Ladies and gentlemen, let's join for the international webinar today 249 in the topic The New Trends in Educations entitled Monitoring and Evaluations of Mitigation Strategies in Public Schools from Mr. Jonathan F. Bada, Philippines. Ladies and gentlemen, let's start our program with IGP's Fit Your Skill. Please give a warm welcome to Mr. Jonathan F. Bada. Hello, Mr.
Well, a pleasant
Hello.
evening, everyone. Did you hear me loud and clear, ma'am?
Yes, sir. Is it clear? It's time for your
Okay.
presentations today. And before your presentations, please introduce yourself. Good luck.
Okay. Well, selamat malam to our Indonesian's friend. Shubo Shanda to
Selamat
our
malam, sir.
Bangladesh friends. Okay. And Wan Shanghao to our Chinese friend. And to all, a pleasant evening to the Philippines. Magandang gabi po sa inyong lahat. So, a pleasant evening, everyone. Okay. So thank you very much for this opportunity. So I would like to thank the Institute of Global Professionals and to all partners, to Sir Kaushik, Ma'am Wendy as moderator, and Dr. Arnold. So thank you very much for this opportunity. Okay. So let me share first my presentation. Ma'am Wendy, is my presentation on screen? Hello?
Oh. Your PowerPoint is not clear. We
Okay, it's
didn't find
clear.
it. Yes.
Okay. So, by the way, ladies and gentlemen, I am Jonathan Fernandez Bada. Okay. Currently an education program supervisor for technology and livelihood education. Okay, the SDO or Schools Division Office of Olongapo City, Philippines. Okay. So at the same time, I am a competency assessor for agriculture and a part-time college instructor. So our topic this evening is all about the monitoring and evaluating COVID-19 mitigation strategies. Okay? So on March 11, 2020, the World Health Organization declared the coronavirus COVID-19 outbreak as a pandemic. So from that,
Excuse me,
we
sir.
already know what is. Yes,
Excuse me,
ma'am?
sir. Your
Yes?
PowerPoint is not visible. Please share
Oh,
your PowerPoint here.
okay, okay. That one, ma'am? Is it okay?
No, sir.
That one?
Okay. Yes. Yes.
Did you see it, ma'am?
Yes, sir. Is it clear?
Hello?
We can. Hello. Yes, we can find.
Did you see my screen, ma'am, Wendy?
Not yet, sir.
Oh, what happened? Just wait.
Okay, sir.
That one, ma'am?
Not yet, sir.
Oh,
Okay. Okay, okay.
is it okay?
Yes, yes. Is it okay? Okay, is it clear, sir? Good luck.
Ah, okay. Did you read already the title? Is it the title on your monitor?
Yes, sir.
Okay, thank you very much. Okay, so I'm sorry for technical problem. Okay, so I repeat as what I have said. So last March 11, 2020, so the World Health Organization declares the coronavirus COVID-19 outbreak as a pandemic. Okay, so we already know what is the coronavirus, how does COVID-19 spread, what is COVID-19 and symptoms, how long is the incubation or the uh, and others. Then, of course, why we need to monitor. Why we need strategies. Important. So because through that we can identify what is our needs. So some of my presentation it is on the context of enterprise or business, but of course we can translate or divert it into an educational system. Okay. So it's critical to have mechanisms in place for monitoring and evaluating COVID-19 mitigation efforts as K-12 schools reopen for modular and online teaching. So that is our modality. Online, modular, or a combination of these two modality. So the COVID-19 epidemic has wreaked havoc on educational systems worldwide, affecting almost 1.6 billion students across 190 nations and continents. School and other learning places closures population. So with up to 99% in poor and lower middle income nations. So that is according to the United Nations in 2020. So monitoring and evaluation provide useful data to state and local public health and educational institutions. So school and district administrators and assessment professionals, that's according to Goncola of 2014, so allowing them to make timely decisions to support the health and safety of all students, the faculty and staff, as well as promote health equity. That's according to Center for Disease Prevention of 2020. Education and public health groups collaborate to find the best technique for collecting data that is representative of their local area by Rodolph of 2013. Because baseline data may not be accessible, it is challenging to create a monitoring method during a crisis, especially to assess changes in learning outcomes, according to Harvard Law Today of 2020. Despite efforts to offer remote learning options, COVID-19's closure of schools throughout the world has led in millions of children losing their learning opportunities, according to Liti of 2021. Because many families struggle to afford school fees and children are compelled to work to supplement their family's income. Financial uncertainty within families can have an influence school admissions from UNESCO in Bangkok, Thailand 2021. When the school reopens, it may be necessary to assess students' attainment levels following the closure and to take additional measures to enable children who were left behind learn more successfully. That's according to Tawan of 2020. In these times of uncertainty, the department also faces a number of security challenges, including the need to address the climate of fear among students, teachers, parents, and other stakeholders, strengthen coordination and cooperation at the national and local levels, and mobilize partnerships and support from a broad constituency. To address the security issues, mechanisms such as the DepEd Task Force or the Department of Education here in the Philippines Task Force COVID-19 for Past Monitoring and Reaction, as well as the restructured Oplan Balik Eskwela, that is Go Back to School, and Brigada Eskwela, that is in preparation, have been put in place, that is according to Department of Education Philippines in 2020. Data is already being gathered on a national and local level, and it may be used for monitoring and assessment. This data could include school administrative records, for example, past and current students and faculty absenteeism, school cancellations, school reopening plans, standardized testing scores, as well as policies, for example, stay-at-home orders, mass gathering restrictions, mask wearing requirements, school or district policies and recommendations. That's DepEd 2021. So primary data can be collected from a variety of sources, including school-developed surveys, school district surveys, interviews, focus groups discussion, and community surveys done by the Health Department, to name a few. The Department of Health 2021. Why is mitigation important? Why do we need to mitigate? So here are some importance of mitigation. Hazard mitigation planning reduced the risk to people and property and reduced the cost of recovering from a disaster. A hazard mitigation plan can help communities become more sustainable and disaster resistant by focusing efforts on the hazards, disaster prone areas, and identifying the mitigation actions. How prevention can be done? Okay. This is also based on the International Labor Organization of 2020. Regular consult your occupational health excuse me, services, local public health authority or other partners who may have developed information materials to promote workplace prevention of risk of exposure to the virus and other technical advice. So specific and reliable information on COVID-19 has to be collected and analyzed. Okay. Next is establish a workplace system for providing up-to-date, reliable information to workers. Okay? To workers, to workers on the emerging situation on COVID-19 with reference to information released by the national or local health authorities. Such information should be provided to workers in a user-friendly way that can easily be understood by everybody. Okay? Next, okay. Develop and post a statement of management's commitment and responsibilities to reduce the risk of exposure to the virus and transmission of COVID-19 at the workplace in consultation with workers' representative. So in here, so the clear commitment of top management in the industry, okay, builds a strong foundation for effective cooperation between employees and their workers. So it's the same, no, between the learners, the parents, and the teachers or the internal stakeholder. So if that is for the education. Next is develop a preparedness and response plan for COVID-19 prevention at workplace, considering all work areas and tasks performed by workers and potential sources of exposure. So as part of occupational safety and health management system, so those enterprises should make arrangement for emergency prevention, okay, preparedness and response for different scenarios, including the outbreaks. So some examples is for the enterprises or for business, but we can, as what I have said a while ago, so we can repair it also into an education system. Okay. The next one is, okay, integrate safety and health into your contingency and continuity plan, and consider other learning and teaching related requirements, including which operations must be done with a reduced workforce. Okay? In a business continuous continuity plan that is developed with the full participation of workers, okay, will help to identify the risks that might affect the specific business or the organization in a crisis and to devise strategies for reducing its impact. Excuse me. So I'm sorry. So we'll continue. So develop a plan for what to do if a confirmed or suspected cases of COVID-19 is identified at the workplace. That includes, among others, reporting, monitoring, and disinfection in line with national guidelines. So in here, so the health surveillance is an important prevention measures. Okay, next slide. Okay, establish a monitoring and evaluation mechanism for COVID-19 prevention strategies and plans. So in here, the prevention strategies and plans should be regularly reviewed, okay, to ensure their continuing suitability. Okay, so map the hazard. Okay, map the hazards of all operations covering all jobs. So a hazard is anything that has the potential to cause harm to the safety and health of a person. Okay, next, we have assessed the risk of potential interactions among workers, contractors, customers, and visitors at the workplace. So in schools, we have the faculty, the non-teaching staff, okay, the outside stakeholder, the learners, of course, the customer, and others, okay, at the school or the workplace, and contamination of the work environment, and implement measure to address the risk identified. So in here, okay, in order to take appropriate measures to protect workers from the occupational risk of exposure to the virus, as far as a reasonable practicable, employers, okay, should carry out a risk assessment. So in school, also the administrator need, okay, to have this risk assessment. Next, we have promote teleworking for non-critical workers to minimize the transmission of COVID-19 in the workplace. So, teleworking should be applied whenever possible as it represents a good preventive measure, especially for the high-risk workers. So if online is not feasible, introduce shift, okay, to avoid large concentrations of workers, okay, in the facilities. So when the nature of work does not allow teleworking or online, shift are a possible measure to maintain employment levels while retaining a lower number of workers into the premise. Okay, so that's what our division office did. Okay, so we have a work arrangement. Okay, next. So avoid in-person meetings, giving reference to phone calls, email, or virtual meetings if you need to organize in-person meetings. Organize the meeting space to allow for physical distancing. Okay? So meetings should be avoided whenever possible and replaced by phone call, video conferences, or email exchange. When meetings cannot be avoided, physical distancing must be ensured. Okay? Next. Train management, workers, and their representatives on the measures adapted to prevent the risk of exposure to the virus and how to act in case of COVID-19 infections. So training programs should cover all workers of the enterprise or in the school, should be conducted by competent person and should cover the measures adapted to minimize the transmission of the virus in the workplace. Okay? Okay. Organize work in a way to allow for physical distancing of at least 2 meters or 6 feet from other people or whatever distance is prescribed by the competent authority. So the workplace or school should introduce measures to keep a distance at least 2 meters between people and avoid direct physical contact. Provide staff, customers, and visitors with ample and easily accessible places where they can wash their hands with soap and water or disinfect their hands with sanitizer and promote a culture of hand washing. Okay? Personal hygiene should be ensured for everybody accessing the workplace, not only for staff, but also for external workers or the external stakeholder, the parents, the people in the community, and others. Next is the put sanitizing hand rub dispenser in prominent places around the workplace and make sure that they are regularly refilled. Okay? So regularly and thoroughly disinfect your hands with an alcohol-based hand sanitizer when you cannot use a soap and water. Next, promote a culture of regular wiping of desks and workstations, doorknobs, telephones, keyboards, and working objects with disinfectant and also regularly disinfect common areas, including toilets, surfaces that are touched frequently should be cleaned more often depending on specific operations. Consider hiring cleaning and disinfecting services. Okay, ensure the cleaning and disinfection of objects and surfaces that are regularly, such as desks and workstations, the doorknobs, etc. Okay, next. Okay. Promote and communicate good respiratory hygiene and work at the workplace, such as covering the mouth and nose with a bent elbow or a tissue when coughing or sneezing. Okay, respiratory hygiene is part of personal hygiene and consists in covering the mouth and nose with a disposable tissue or in its absence with a vent elbow when coughing or sneezing. This simple measure greatly limits the dispersion of respiratory droplets in the environment and decreased the risk of contaminating the hands. Dispose all the tissue immediately after use in the nearest closed waste bin and wash and dry sanitize the hands afterwards. Okay. Ensure social distance at the workplace and remain out of congregate settings, placed where people meet and gather as much as possible. So the density of people in the building should be reduced by ensuring physical spacing of at least 2 meters, okay, for work sites and common spaces, including pantries and the kitchens. Okay. Provide appropriate face masks and make available paper tissues at work sites for use by those who develop a runny nose or cough, along with closed bins for hygienically disposing of them. So appropriate masks, okay, should be provided for workers who develop symptoms such as runny nose or cough. So together with closed waste containers to dispose of them. So disposal tissue should be made available for them. Okay. Next, arrange for the isolation of any person who develops COVID-19 symptoms at the same work site while awaiting transfer to an appropriate health facility. So in the event that any person develops symptoms, okay, at the workplace, arrangements should be made for their immediate isolation in separate room. Okay, so that is the suggestions. Okay. Inform workers that they have a right to remove themselves from a work situation that poses imminent and serious dangers to their life or health in accordance with national law, and establish procedures and should promptly inform their immediate superiors of the situation. Okay. So in here, according to the national law, inform staff, okay, of their right to remove themselves from any situation which they have reasonable justification to believe presence an imminent and serious danger to their life or health, as well as the need to immediately inform their direct supervisors. Next. Maintain regular communication with workers and workers' representatives, including over the internet or when that is not possible over the phone. So communication should be maintained, okay, with sick workers and their families, as well as with workers who are temporarily teleworking, okay, or online, in order to ensure the necessary company or school assistance and provide moral support. Next, assist workers in managing any emerging psychosocial risks or new forms of work arrangements, and in promoting and maintaining healthy lifestyles, including with respect to diet, rest, and sleep, exercise, and social contacts with friends and family. So ensure that new working arrangements such as online properly function and do not generate or worsen psychosocial risk. In line with the guidance, okay, of local authorities, encourage workers with suspected symptoms, okay, of COVID-19 not to come to the workplace and to comply with other aspects of such guidance. So workers would develop symptoms of COVID-19 must not assess the workplace, so they should stay at home, okay, and follow the instructions of health authorities. So stay at home. Okay, next. Advise workers to call their health care provider or local public health department when they have a serious health condition, such as breathing problems, and to improve details of present trouble and symptoms. So calling your health care provider, such as general practitioner, okay, or the local public health authorities after developing symptoms suggestive of COVID-19, especially if severe, such as breathing problem, is very much important. So what are the mitigation strategies in schools? So we'll now proceed to school. Increase physical and mental resilience. The school encourages teachers to be first more resilient as well and more likely to stay positive about the future even when faced with seemingly insurmountable obstacles. The school encourages teachers to often turn to help others when need to relieve stress and boost self-efficacy. Set of beliefs about rights and wrong generally have an easier time bouncing back. Often find faith helpful in surviving challenges and coming through stronger and wiser inside. So have a healthy sense of humor and are able to laugh at their own misfortune or at an advantage when it comes to bouncing back for obvious reasons. The school encourages teachers to draw strength from desire to emulate person. The school encourages teachers to equip to bounce back from loss or disappointment. School encourages teachers to leave their comfort zone and confront their peers, are more likely to overcome their challenges. This person. School encourages teachers, okay, to believe they have a purpose, less likely to give up when faced with tragedy or loss. School encourages teachers to be healthy and practice good hygiene. Okay, how to reduce transmission, promoting COVID-19 vaccination for those eligible. Are we all vaccinated, ladies and gentlemen? I hope so. So consistent and correct use of masks by people who are not fully vaccinated, physical distancing among people who are not fully vaccinated, but how we can determine if they are vaccinated or not? Okay, that's a big question. Screening testing in K to 12 schools, improving ventilation is very much important, not only in the school, but also at home. Hand washing and respiratory etiquette is also important to reduce transmission of COVID-19. Staying home when sick and getting tested. Okay, so just stay at home. Testing and contact tracing in combination with isolation and quarantine. Routine cleaning with disinfection under certain conditions. Information drive for all stakeholders. Reduce contact. Okay, how can we do this? Maintain a distance of at least 1 meter between everyone present at school. It's referring to teachers, okay, and then teaching staff. Use signs, ground markings, tape, barriers, and other means to maintain 1 meter distance in queues around entrance. Discuss how to manage physical education and sports lessons. Move distributions outdoors for ventilate rooms as much as possible. So follow the alternative work arrangement. Okay, so follow the alternative work arrangements. Uh, Office, the following days work from home, office, so something like that. Schedule distribution and retrieval of modules for modular distance learning. Okay, so maybe that is once a week or once every 2 weeks, or it depends, okay, upon uh, the decision of the school heads, and of course considering uh, the local situations. Okay, online enrollment. Okay, of course, to prevent the rapid transmission of the virus. Okay, we did online enrollment. Motivate parents to enroll students in online class or digital modular. Okay, so motivate parents. So we motivate the parents. Okay, in order to enroll their kids or their children in online class. Submission of documents online. That's so very easy. Virtual meetings of faculty and staff. So reduce durations of infection. Early detection and isolation of symptomatic staffs. Ensure the establishment, setting up, and refurbishment of clinic for health assessment. It's also important. Okay. Provisions of appropriate interventions such as first aid kit or treatment. Proper management of symptoms of personnel, teachers, and parents. Then ensure the provision of referral and follow-up of status of learners, teachers, and personnel in appropriate health facilities. So that's all. So thank you very much. Ma'am Wendy.
Great presentations, and thank you so much give, giving us your valuable time because you have and your experience about this webinar tonight. Thank you so much, sir.
So thank you very much. Thank you very much for listening. So I hope I shared, okay, some ideas on how to mitigate, okay, this COVID-19, how to evaluate, how to
Uh-huh.
monitor, and how to reduce the number of cases. So thank you.
Okay, sir. Thank you. Well, ladies and gentlemen, after his speech, please thanksgiving of his speech and presentations. That's excellent. Well, ladies and gentlemen, I remind you, please like, share, and subscribe YouTube channel Institute Global tags and comments this page because your attachment encourage us to do better and best service to our lovely audience. Well, ladies and gentlemen, for the next sessions, we open quiz competitions. Then I will guide you to rate some quiz and I will give you information who is the winner later. Let's start. Yeah, ladies and gentlemen, for the next sessions, we open quiz competitions. Then I will guide you to read some quiz and I will give you information who is the winner later. Please join at slido.com. The password is IGP quiz. Let's start. Okay, ladies and gentlemen, for the join these quiz competitions, please click slido.com and the password is IGP quiz. You can check in link in comment box. Let's join. Okay, quiz here www.slido.com and the code is IGP quiz. We will pick your name from quiz or Slido, so join with your full name which will directly print on certificate. Let's join everyone. And after quiz, we have Q&A, certifications process, step by step. Ladies and gentlemen, join at www.slido.com and the code is IGP quiz. You can check link in comment box. Okay, the first questions for you all. The COVID-19 epidemic has wreaked havoc on educational system worldwide, affecting almost up to how many percent in poor and lower middle income nations? Okay, the truth is, okay, the truth is, ah, B. Okay, for the next questions, when the school responds, it may not be necessary to assign students attainment level following the closure. Okay. It's a bad connections, ladies and gentlemen. So sorry. Okay, I'm so sorry. It's a bad connections. Okay. The truth is B. Next questions. Okay, the next questions here. Mapping the hazard of all operations covering all jobs is not important. True or false, guys? Okay, here the statement is mapping the hazards of all operations covering all jobs is not important. So, true or false? Take it your answer. So, the truth is, ding ding ding. The truth is, okay, the truth is false. Next question here. How many meters is allowable in social distancing? A, 6 meters or B, 2 meters? 6 or 2, everyone? Okay, the truth is 2 meters. Okay, for the 5 questions here, regularly consult your occupational health service, local public health authority, or other partners who may have developed information materials to promote workplace preventations of rise of exposure to the virus. Okay. The truth is, okay, the truth is true. Okay, next question here. Is it necessary to provide hand soaps and washing area in the schools? Yes or no? Yes or no, everyone? So the truth is, okay, the truth. I'm Is a bad connections here? I'm so sorry. Okay. Surfaces that are touched frequently should be cleaned occasionally. True or false? True or false, guys? Okay, the true is false. Okay, for the eight questions, how to increase physical and mental resilience? A. Turn to help others when need to relieve stress and oppose self-efficacy. B. Consistent and correct use to mask by people who are not fully vaccinated. The truth is, okay, the truth is A. Turn to help others. Okay, for the nine questions, staying home when sick and but not getting tested. A. True or B. False? True or false, guys? Okay, the true is false. Okay, for the last questions, ensure the provisions or referral and it's a quickly everyone. Okay, the last question, to repeat again, ensure the provisions of referral and follow up of status of learners, teachers, and personnel to inappropriate health facilities. A. True or B. False? True or false, guys? Okay, the true is true. The true is true. Yes. Okay, congratulations, Anna Mary Joy Marcado. You are the first winner, and congratulations all. Congratulations all. You have done. Okay, congratulations, quiz competitions winner is the top 10. Okay, well, ladies and gentlemen, for the next sessions, we open questions and answer. Please type your name, country, and your questions for the uh, for the speakers, and the speakers will answer it. Let's start. Okay, ladies and gentlemen, repeat again. For the next sessions, we open questions and answers. Sorry, questions and answer. Please type your name, country, and your questions for the speakers today. And the speakers will answer it. Let's start. Okay, ladies and gentlemen, for the next sessions, we open questions and answer. Let's start. Okay.
Hello, sir.
Hello. Hello, everyone.
Hello, sir. Open
Hello,
your
sir.
camera.
Oh, sir, please on camera.
Okay.
Okay. Okay. Here for the first questions for you, sir, I will read from Miss Manolita. The questions is, what are the CDS guidelines for schools, especially the recommendations for the mask in schools amidst the COVID-19 pandemic? Time is yours, sir.
Okay. Can I ask first what is the meaning of the CDC? Ma'am White?
Okay, sir.
So, Ma'am White, I'm not familiar with the CDCs, but for the face mask, using of face mask, especially in school amidst the COVID-19 pandemic, we noticed that from time to time it is slowed down or it reduced the number of cases, but the same, okay, we are obliged to use the face mask wherever we go. When we're going to the market, when we're going to school, still, okay, uh, they impose that all of us need to wear face mask.
Okay, thank you so much, sir.
So thank you very
So,
much, Ma'am White.
okay, so for the next questions, for the next questions, okay,
Okay,
sir,
so
Miss
okay, thank you
Manolita,
very much. CDC,
yes,
meaning Center of Disease Control and
yeah.
Prevention. So I think different country, so different names of agencies no involved in the COVID-19. So in here is in the Philippines that I think that is the IETF, the Interagency Task Force for COVID-19. So the same ma'am. Okay, in the Philippine setting, so uh, despite of lowering or reducing the number of cases of COVID-19 is still the impose that everybody will use the face mask wherever you go. When you're going to school, in the market, as is, you need to wear face mask because pandemic is still there. Okay? So thank you.
Okay, thank you so much, sir. Okay, well, for the next questions here from Mr. Sheman to our speaker, the questions is, what can you say about the proposed no vaccine, no enrollment policy in a public and a private schools? Are you in favor to this, sir? Thank you.
Okay. So these questions, no, asking my personal point of view regarding no vaccine, no enrollment policy. So this policy, I am disagree because even you are not vaccinated, as long as you are healthy, you are entitled, okay, for the education. Okay, everyone. So that is the rights of every people to have an education. So no vaccine. So vaccine is not a prerequisite. Okay, to get good or better educations. Okay, so thank you.
Okay, thank you so much, sir. So, for the next question from Mr. Jeffrey Salim, the question is, do you agree of having the face-to-face classes at this moment where COVID-19 is still at rise? Time is yours, sir.
So I am agree, but it is limited face-to-face classes and in a location where there are no or a minimal number of cases. So face-to-face classes is very much important, especially in the kinder, okay, or in the preparatory, uh, in the preparatory. So because they need, okay, to know, okay, to classify everything, okay, to to see the real object, okay, and of course, face to face is very they are awaiting students. They wanted to have their face to face classes because it's so very happy. So they are happy. So if they have a face to face because they meet their classmates, okay, their teachers. Okay. So my point here, okay, or my sides here is I am agree with the face to face classes, but the minimal face to face and in the selected areas only. So thank you, Sir Salem.
Okay, thank you, sir. So, for the next questions again. Okay, from Miss Manolita Ramas Oliga, the question is, if unvaccinated students are allowed, what are the guidelines for schools to prevent the spread of COVID-19, sir? Time is yours.
Okay. If the unvaccinated students are allowed,
Mhm.
which is we need to allow them to go to school, right? Because taking vaccine is not a mandatory in the Philippine setting, no? It's not mandatory here, okay? But they are encouraged that all, okay, to be vaccinated, okay? So what are the guidelines for the school to prevent the spread of COVID? Okay, so I think the school or the Department of Education will formulate guidelines, okay, for this particular scenario or situation. If if they find out that this is the good strategy, okay, just to prevent the spread of COVID-19, if they are have a plan to uh, because if we are going to segregate no the unvaccinated to the vaccinated students, so they have something wrong, okay. So I think much better, okay, to formulate guidelines, the authorities, okay, to impose or uh, to give, okay, to the schools what they wanted to uh, impose, okay. So that's my stance for that, Ma'am Oligo.
Thank you so much, sir, for a great answer.
It's so
For the
very
next
interesting the
question,
questions, right?
yes, about vaccine. Okay, next question here from Miss Mirasol. The question is why frequent hand washing is very important and must be practiced at all times, especially at schools. Time is yours, sir.
Okay. Okay. Frequent hand washing is another recommendation. Okay. Just to eliminate or reduce the number of cases because through hand, okay, we use it frequently, and maybe it is we can encounter some bacteria or some pathogens or virus that might transfer to others, okay. So that's why we need this frequent hand washing. This is part of the hygienes of everyone, not only for the students in school, but also we need to practice it at home. So thank you very much, Ma'am Silaga.
Okay, thank you so much, sir. Thank you, Miss Mirasol. Okay, next question here from Miss Manolita Ramas Oliga again. The question is how do teachers help mitigate the psychological effects if there is a lockdown? Time is yours, sir.
Okay. So it's a very good question again, Ma'am Oligo. Ano? How do teachers help mitigate the physiological effects if there is a lockdown? Okay. So in the Department of Education, there's a lot of programs. I think even in other country. So government have a lot of programs on how to help teachers. Okay, especially the psychological side. Okay, because lot of teachers. Okay, especially here in the Philippines. Okay, so it's affect especially during lockdown. Okay, so there are some country have their own, okay, mitigation strategists, okay, so that they employ to their colleagues or to their teachers or to their employees.
Okay, thank you so much, sir. For the next questions, questions from Mr. Julius Torres. The questions is how can we ensure safety if some of our colleges are not yet vaccinated and they don't want to be vaccinated? He's from Philippines also. Time is yours, sir.
Okay. How can we ensure our safety if some of our colleagues are not yet vaccinated and they don't want to be vaccinated? Okay? Whether you are vaccinated or not, still we are not safe unless we do the proper protocols. Okay? So we need to obey the rules and regulations, okay, imposed by the IETF. Okay, thank you.
Okay, thank you, sir. For the next questions from Mr. AK Adikeri. The question is what can we do when bad network and COVID-19 are pandemic? Time is yours, sir.
So what we can do when both network, okay, and
Yes.
COVID-19 are pandemic. So so I think it's a very hard questions, but uh so we can do a lot with our own, okay, for our safety, and people, okay, we are intelligent and we can find ways, okay, on how those problems or obstacles we can overcome. So thank you very much.
Okay, thank you so much, sir. Thank you so much, Mr. AK, for the questions. Well, for the next questions, for the next questions, gentlemen, time is over. Hopefully, we can learn something new and we can implement for this life. Please leave a review, like this page, and please like, share, and subscribe YouTube channel Institute Global Professionals. If you learned something from this webinar, and please share the information with your friends. Thank you so much for your attention. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. And thank you so much, sir, for your valuable time because you have done to share your knowledge this webinar today. Thank you so much, sir.
So thank you very much.
Okay, ladies and gentlemen, for your information, please note, dear learners, we saw that at this moment you feel difficulties with using the website. We notice all the things and working on it. Thanks for your patience. For the certificate, please collect the certification link and certificate code at this moment and try it in your free time. We saw that it occurs when lots of user wants to join our webinars. This is a temporary problem with our hosting provider. Again, thank you so much for your patience, ladies and gentlemen. And please note these information for you guys. Okay, here today's certifications process. Please click www.eduigp.com. Here, instructions, certificate, code require, the name of the program today, monitoring and evaluations of mitigation strategies in public schools. The code is IGP 4961. Without code, no one is eligible for certificates. With code, you can claim your certificate anytime. Without an account on our website, you can visit, but you cannot do anything functionally. Okay, so that is instructions to get certificate for you guys. Okay, ladies and gentlemen, I give you information again. We saw that at this time moment, you feel difficulties with using the website. We notice all the things and working on it. which is not our problem, but still our technical team working on it. Thanks for your patience, guys. For the certificate, please collect the certification link and certificate code at this moment and try it in your free time. We saw that it occurs when lots of user wants to join our website. This is a temporary problem with our hosting provider. Again, thank you so much for your patience. So I think enough. Thank you so much for your attention, guys. See you next time.